Okay. So a little bit about me. Let's see if this works. Joe said it was fancy, so do I need to point it at the computer? There we go. Okay. A little bit about me. Definitely a verbal affirmer. You can either cheer if you like something that I'm saying, or head nod, or like seem interested. I'll keep going. Definitely a massive storyteller. Fun fact about me: my undergrad is actually in theater education. How I ended up in tech, that's a story for another day. But I'm at HCA. I do work with some A.Team builders. So I kind of wanted to set the tone of the perspective that I'm coming from. Rolf told me not to sell myself short, but I am not a technologist in this space, but I'm definitely in an innovation and architecture, and I surround myself by technologists, and I support them as we are continuing to innovate in our healthcare world. So I'm going the wrong way, actually. It's me hitting it backwards. That's part of the problem. So I'm in a group at HCA in a tech space called Accelerated Technology Innovation. And we are actually, I like to kind of view ourselves as internal consultants within the four walls of HCA. Typically in our healthcare space, business operations are directly coupled to an IT group, and that IT just supports what the business is wanting, needing, whatever their momentum is. For us, a little bit on the consultancy side, we're tasked with large C-suite level problem statements, and that can be in any different kind of business lines. We have our hand in supply chain, clinical case management. I mean, you name it, we've had to kind of touch a problem statement, and that can look very different. And so why I say consultancy is we have to become SMEs really quickly to provide value. And so we have that same kind of mindset of where can we add value with inside our four walls. Obviously, business operations lines have a potential to not need to create a custom solution, which is where our specialty is, but they can also buy point solutions with vendor products. And so lo and behold, we actually compete against that also internally. And so we actually cultivated a process of when we're assigned to a problem statement, we call it's a service offering, if you will, and we view it within 2 milestones. And again, all of this is enriching to try to cultivate an innovation approach within something that's tough to change, which is healthcare. And we are in a tech space, so all of our solutions are revolved around a technical solution. And so our 2 core milestones are idea acceleration and delivery acceleration. Where I sit within our group is primarily in the idea acceleration. We actually have A-Team builders in both of our core milestones. So anywhere from a product manager to a product designer guiding us through the idea acceleration process in a full pod structure. That's coupled with maybe a data analyst, data engineer, or a senior principal architect. That's kind of what's happening in the idea acceleration side. And we're taking it all away from initiation, which is defining the problem statement, through innovate. And that's kind of like, what is your ideal state that you're after? Maybe that ends with some high level fidelity comps associated with the architectural diagram, but really we've already unpacked it all to then hand over into a delivery acceleration, which is taking it all the way into an operational flow. And that is a huge feat in our healthcare space, especially at HCA. Implementing something at one facility isn't necessarily taking it to operations. So how do you cultivate innovation in such a large operations? And I will say I've seen massive investment from HCA on not wanting to disrupt. And so I do feel like our department was created for disruption. And in such an aged spot like healthcare, it is a tough thing to even still be within those 4 walls and say, hey, I'm investing in cultivating an innovative structure. So that is our goal. Wanted to kind of give you a background of where I'm specifically coming from. But I promised A.Team I would bring to the table a particular product that we are working on. Again, I won't probably go in depth to exactly how we're using Gen AI into it, but I can kind of at least give you the gist and where it's applied and kind of where the original problem statement existed. I'm waiting for these cards to be like, you have 1 minute left. Okay, so first investment. HCA is currently partnered with Google. Google is our strong tech 3 minutes. Okay. Google is our strong tech partner. And I mean, at the core of it, um, we call it our HCA intelligence net, but we partnered with them to create an intelligence net to be able to easily leverage their tooling, their generative AI tooling. In the past, I would say the relationship is more business has a problem. We're going to parse our own clinical information via HL7 just to solve that one problem in this one product. But HC has a ton of data, and we have to be smart about how to use that. And so the first investment is creating a data platform that actually is making it meaningful and easy to leverage. Our team, through the Accelerated Technologies team, is one of the first teams to have to pressure test what it is that we've already invested in. And in order to pressure test that effectively in our space, you have to apply it to a use case. The business isn't necessarily fully understanding on an operations side. A clinician is not necessarily saying, tell me more about this intelligence net. They're saying, I have a problem to solve. Surely tech can solve it for me. Come help me. And so this narrative is really hard to get across of why the investment is critical, but HCA is getting that and working their way towards that. And they've invested in creating groups like the one I work for within HCA to cultivate that and really pressure test it. So these are a bunch of fancy words that I probably can't necessarily have a full-fledged conversation on. But some of the tooling that we're using is HDE, and then Vertex AI, so on and so forth. So let me kind of express to you a little bit about how we're leveraging that. So if that's our data platform, 1 minute. If that's our data platform on the left-hand side, we're not necessarily saying that's our product ecosystem, but we've created a data layer that is accessible via an API or a data lakehouse so that multiple people can leverage this platform and they don't have to parse their own instances from this platform that we've already invested in, but we're making it available for all. Then there's a logic layer, and within that logic layer, it is enriching and enhancing. Both the data layer and logic layer are enhancing an experience layer, if you will. But in that logic layer, that's where we're consuming large language models, machine learning, and we're ingesting that and creating a modular experience. And so I'll go into the experience layer because that really is where the product specific is. But one of the toughest things for clinicians and really for any subsequent thing that touches a medical record is finding information within that medical record for your need. And so where we are first tackling is creating this platform and, again, a modular experience approach to how are we extracting and abstracting. I had to learn those definitions. It was very critical. Information to put it and present it to whoever that colleague is, whether that be a physician bedside and say, hey, I'm trying to find a high risk scenario. And it's really hard to find exactly that before I go ahead and say what the treatment plan is. And that's risky. And so we're cultivating a summary and we're doing it in I don't want to call it baby steps. It's monumental change and a shift of thought process, but we're doing it in a healthy, very succinct fashion. We're not just saying, hey, generative AI, create me an entire clinical summary of this encounter. That's dangerous and not helpful. So we're splitting it up into what we call these tangible parts. And some are unstructured data, which that's what we're using large language models for, of entity extraction. And some of it's structured data, which is a little bit easier to ascertain and summarize for it. So again, that's the summary piece. The records piece is we're breaking it down through tangible domains and making it easier to navigate through. And then what we're still kind of working towards building is timelines, vertex searches, and chat. I'm rushing now towards the end because I'm feeling some pressure. But this is the specific product that we're working on in the use case. But it's all of it is tapping into multi-personas to leverage something like this, all really trying to tackle through. It is very difficult to navigate through the EMR, and we have a wealth of data. But we definitely imagine that this can be used in supply chain and this exact approach. And so how do we become stronger stewards of our HCA data and really pressure testing the technology and how it's emerging and in an environment which is slow to change like healthcare. So that's kind of my core speak. So I'll be around for any questions later.